Nurses and midwives understand that patient demand is seldom static. Our wards and hospitals are subjected to surges in patient demand within a shift on any given day, week, month or year. This can leave nurses and midwives on the clinical floor struggling to provide all the care the patients require. It can become necessary for nurses and midwives to ration care in order to cope with sudden increases in workload. This can result quickly in the degrading of the care environment on the ward and can place patients at risk. The CCDM FTE calculation accounts for usual patient demand variation and provides for rosters and budgets to match this. It's still necessary that wards and hospitals have effective ways of responding to unexpected surges in patient demand. These responses need to be timely, coordinated and effective to ensure patient safety is not compromised. The CCDM Variance Response Management or VRM system is designed to do this. The suite of VRM tools helps DHBs to identify this situation quickly, understand the nature and extent of the problem, initiate a coordinated and effective response plan, and constantly monitor its effectiveness and make necessary improvements. What's important about this to nurses and midwives? One of the most important tools in the VRM suite for nurses and midwives delivering patient care is the Variance Indicator Scoring or VIS system. This is a system which includes a set of indicators that are pointers or mismatch between staff and the care needed by patients. Each of the indicators is important to patient safety and the quality of care. Out of the 7 indicators in this system, care rationing and professional judgment have the highest weighted scores. This indicator system is reliant on the professional judgment of the ward team in assessing the safety of the care environment. As soon as the ward team identify a mismatch between the patient care that's required and the shift nursing midwifery staffing capacity, the team use the indicator system to alert this to their DHB. The ward's overall variance indicator score is calculated by adding together the scores from each of the indicators to get a total. The total score results in a traffic light colour status for the ward, and this is automatically displayed on the hospital's capacity at a glance screen. The DHB then activates its standard operating procedure. This is a planned list of standardised actions to respond to variance. It takes the guesswork out of who does what, when. The plan aims to get the ward back to optimal functioning as quickly as possible. The DHB CCDM Council is responsible for monitoring the effectiveness of the response plan closely and make necessary improvements quickly to ensure patient safety. Here's what we know. Patient safety is at risk when the care that patients require exceeds the capacity of the nursing or midwifery resource to provide it. Nurses and midwives that are delivering the patient care need effective systems to provide early alert when the care environment is degraded. The CCDM Variance Response System is designed to ensure the ward can return to optimal functioning as quickly as possible when there are surges in patient demand. The Variance Response System is reliant on the professional judgment of the ward team in assessing the safety of the care environment.
So the nurses indicate, based on their trend care assessment, what the variance is plus or minus their trend care, and in addition we take into account professional judgment of the nurse in order them to enable them to say that all of the indicators have indicated that the ward might be okay, but their professional judgment says that it might be a difficult shift, and in particular they might take into account the skill mix of the ward, whether they've got a lot of new graduates on, for example, that changes the skill mix and so there's not enough senior staff, whether they have more ENs than they should, perhaps the healthcare assistant ratio is right. So take into account those kinds of factors that will impact on the ward, whether their admin person is present, a whole range of things that the nurse uses her professional or his professional judgment in order to indicate whether the workload of the ward is as reflected, and that adds an additional indicator, bringing the ward into a variance colour. Ideally everybody is green, but it's basically a traffic light system that allows people to indicate as the variance of the ward increases whether they are yellow, orange or heaven forbid red. When their indicator is ranked and they get their colour, that links to a variance strategy management that enables a series of actions which are relatively well embedded that they know that they can do. So they notify their CNM, we expect perhaps as the CNM might work on the floor, they let the duty manager know so that the duty manager can find additional help if that's required. And it's quite routine in this hospital to move staff from areas of low variance where they are in positive variance to areas of high variance. And those conversations are commonly had where we might say, can you please move your nurse to ward X because you are currently sitting at +10 and they are currently sitting at -2, and we like to even that out. And so the goal of the whole system is to even that out and make sure that everybody is working at a fair work rate, and that no areas are working, having an easy day while other areas are having a particularly hard day, and therefore creating an environment that is providing unsafe care to patients and providing an unsafe environment for staff to work in. So our goals are to even that out and make the environment safe for staff. Overall, what we're trying to achieve is a hospital where patient care is delivered in a safe way, where nurses feel that they are working in a safe environment and that their workload is valued and measured.
Our job is constantly endeavouring to look at trend care, to look at variance response and manage that whole situation. With the increase in FTE, we have definitely noticed a difference. I think we've got more ability to care for patients and maybe less firefighting. There's a bit more of a buffer, there's a bit more to come and go on. As a duty nurse manager, when you allocate a sick patient to a ward, when you're in a negative variance or when you're in yellow or orange, it's actually really hard to go, here, have some more work. You're already not getting dinner, you're already looking stressed. It's really nice walking onto a ward and there's not 5 call bells ringing and heightened levels of stress. So we have definitely noticed the increase with the FTE and the ability to variance response. When a unit or when a ward goes into yellow or orange or red, the ability to redeploy and to pull with this increased FTE is definitely noticeable.
For more information on the Care Capacity Demand Management Program, go to ccdm.health.nz.